high creatinine can indicate kidney disease, and keeping it low can help you avoid the pain and costly treatments associated with advanced kidney issues, such as dialysis. Try these 7 simple habits to lower your creatinine level and maintain healthy kidneys. Avoid over-the-counter anti-inflammatory spell with pain, cold, flu, and fever symptoms. Often take OTC non-steroidal anti-inflammatory drugs, NSAIDs, including ibuprofen, Advil, Motrin, naproxen, and aspirin. NSAIDs can be damaging to people with kidney disease. When kidneys aren't functioning properly, they rely on chemicals called prostaglandins to keep blood vessels open and maintain blood flow. NSAIDs block prostaglandin production, preventing needed vasodilation and decreasing renal blood flow. A 2021 study, Healthcare Basel, examined 18 months of low-dose aspirin use in patients with severe kidney disease not on dialysis. Of approximately 12,000 patients, those taking aspirin had a 15% higher risk of starting dialysis. Low-dose aspirin is often prescribed to prevent cardiovascular disease in CKD, but it may worsen outcomes in severe disease. Caffeine taken with NSAIDs may further increase kidney risk by raising blood pressure, constricting renal vessels, and increasing urination and dehydration. If you do take NSAIDs, drink plenty of water, or better yet, avoid them if you have CKD. In early CKD stages, short courses a few days may be low risk. Longer-term use should be supervised by your kidney specialist. Higher doses increase risks of electrolyte imbalances, hypertension, and worsening kidney damage. Personalize NSAID use with your doctor based on CKD severity, overall health, other meds, and age. Always read labels for contents and warnings. To eat more fiber dietary. Fiber helps feed gut bacteria that break down creatinine and reduce inflammation. It also prevents constipation and balances cholesterol, blood sugar, and blood pressure. Evidence is mixed on direct creatinine reduction, but fiber clearly supports the conditions that protect kidneys, targets, and sources most. Adults, approximately 28 grams fiber. Day DGA, plants only, fruits, vegetables, whole grains, legumes, beans, chickpeas, lentils. Example intakes, 3 to 5 ounces whole grains daily. 1 to 3 cups legumes weekly. 1.5 to 2.5 cups fruit, and 2 to 4 cups vegetables daily. If you must watch potassium, for example. Dialysis. A dietitian can tailor choices. Lower potassium, higher fiber options include cooked broccoli, cabbage, radishes, beets, cauliflower, pears, apples, strawberries, and watermelon. Nuts, seeds, oats can also help. Tip: rinse chopped produce in cold water to reduce potassium. Smaller pieces increase surface area. Western diets are typically low in fiber. A whole food, plant-forward pattern can boost intake and protect kidneys. Limits salt-sodium intake. Sodium raises fluid volume and blood pressure, narrowing kidney vessels and straining the filtration system so waste including creatinine build. A 2020 study, INT. J-mol-C, showed early CKD. Low-sodium diets lowered proteinuria and improved BP med effectiveness. Advanced CKD. Reduced fluid overload and sometimes fewer dialysis sessions. Targets general adults 14 plus. Is less than or equal to 2,300 milligrams sodium day. 1 TSP salt. CCD patients 1,500 milligrams day. 3/4 TSP. How to cut sodium. Favor whole foods. Minimize processed, packaged, canned, and restaurant meals. Read labels. Avoid 400 milligrams sodium per serving when possible. Use herbs, spices instead of salt. Remember, sea salt equals table salt in sodium. Exercise regularly, but avoid overexertion. Regular Activity can improve creatinine and GFR by reducing inflammation, slowing tissue damage from waste buildup, and improving renal microcirculation. A 2022 review found the best outcomes with combined aerobic strength training over approximately 6 months. How to start. Begin low-intensity walking. Swimming light weights, high reps. Progress gradually in frequency, duration, and intensity. Eventually, you may add higher intensity options: running, cycling, vigorous dance. Heavier strength work. Safety hydrate. Avoid overheating, especially in hot conditions. Let your body adapt, especially with CKD. Diabetes, heart disease. Stop if you feel lightheaded, chest tightness, pain, or severe breathlessness. Consult your clinician. Stop smoking. Smoking accelerates CKD progression, notably when GFR 45 milliliters per minute. Nicotine and other toxins narrow tiny renal vessels and promote atherosclerosis, renal artery stenosis, reducing kidney blood flow and elevating blood pressure. A 2022 study. Journal of Multidisciplinary Healthcare linked increased smoking to higher creatinine, even in otherwise healthy people. Quitting can lower creatinine and reduce future kidney damage risk. Quit tips. Ask about counseling, medications, or nicotine replacement. Set a quit date. Recruit support. Plan for triggers. Use relaxation strategies: deep breathing, meditation, frequent smoke-free environments, and new routine. Get high-quality sleep. CKD is often associated with sleep issues, restless legs, sleep apnea, mental health concerns, meds, toxin buildup, dialysis-related napping. Consistent 6 to 8 hours of quality sleep correlates with lower creatinine and slower CKD progression by reducing risks like diabetes, obesity, and hypertension, and dampening stress, inflammatory pathways. A 2019 study, J. Clin, SleepMed, over 8 years found poor sleep quality. For hours sleep or frequent sleep aid use, increased CKD risk. What helps treat restless legs and sleep apnea, including adequate fluid removal and dialysis? Consider CBTI for insomnia. Build a steady sleep schedule and sleep-friendly environment. Eat more plants. Plant-forward diets are safe in CKD and can improve GFR and delay dialysis. They also support healthier cholesterol, weight, blood sugar, and blood pressure, key in preventing renal complications. A 2023 study, AMJ Kidney Dis, following people with various CKD stages for 5 years, found more meat, processed foods, white flour, rice, sugary foods, drinks correlated with worse outcomes and lower life expectancy. More plants equals better outcomes, especially in earlier CKD. Why plants help? More antioxidants gives less renal tissue damage, more phytates gives lower phosphorus absorption. Dairy phosphorus can harm bones, vessels in CKD. Less animal protein gives lower dietary acid load. Reduces metabolic acidosis that accelerates kidney injury, inflammation, muscle wasting, and bone breakdown. Fewer ultra-processed foods gives less salt, sugar, unhealthy oils, and additives. When to see a specialist? Nutrition comes from muscle metabolism and dietary protein. Kidneys filter it into urine, so blood and urine levels reflect renal function. Rising creatinine suggests a falling GFR. Non-renal causes of higher creatinine: intense exercise, muscle breakdown, wasting, pregnancy, dehydration, cooked meat intake, bodybuilding supplements, renal medical causes, infections, certain medications, stones, tumors, injury blocking urine flow, diabetes, hypertension, heart failure, excess weight. If your creatinine is high, treat the underlying cause promptly. You may need a nephrologist, kidney specialist, especially with diabetes or hypertension. Workup may include blood tests, CBC, BUN, GFR, cystatin C urine tests, urinalysis, protein albumin 2, creatinine ratios, creatinine clearance, genetics, saliva sampling in select cases, imaging, ultrasound, X-ray, CT, MRI, biopsy, to diagnose unclear or suspected intrinsic kidney disease. Treatment overview: managing blood pressure. Diabetes and heart failure preserves kidney function. Plans often combine medications with lifestyle measures, diet, sleep, stress reduction, exercise. Weight management. A 2023 review, Kidney Medicine, found exercise had the strongest effect on improving. Creatinine dietary changes helped control BP and reduce proteinuria. Weight loss plus BP control benefited kidney health. Quality of life improved overall. CKD is usually not reversible in later stages. Some people require long-term dialysis, peritoneal at home, or hemodialysis in center, and may be candidates for transplant. Continuous monitoring and treatment of related issues, hypertension, anemia, diabetes, help prevent complications. Key takeaways: creatinine is an early signal of renal function decline. Values rise as filtration worsens. Risk factors include hypertension, diabetes, and excess weight. It's never too late to start small daily changes that meaningfully support kidney health. Your 7 daily habits to help lower creatinine and protect kidneys. Avoid or strictly limit OTC NSAIDs. Discuss safer options with your doctor. Eat more fiber from whole plant foods. Limit sodium to protect BP and reduce fluid overload. Exercise regularly. Progress gradually and avoid overexertion. Stop smoking. Seek structured support to quit. Prioritize 6-8 hours of quality sleep. Eat more plants and fewer ultra-processed foods. We hope you found these habits practical and motivating. Watch more of Health Today's content to stay on top of kidney health and other trending topics. Thank you to all our subscribers and viewers. Your support inspires us to keep sharing valuable content. Tap the bell and turn on all notifications so you never miss a life-saving video. Everything we've discussed today might be wasted if you don't watch the video on screen next. The worst 22 foods that can ruin your effort to lower creatinine and prevent kidney disease, plus easy swaps so you can still enjoy tasty meals. See you there. Stay informed, stay healthy.